Hello, my name is Jeanette Morgan, and for my video journal assignment, I am going to speak about the challenges of healthcare in Texas. One of the main challenges that Texas faces, that I believe to be one of the most important, is the amount of people who live in Texas without health insurance. Having health insurance is very important for many reasons. With there being a high uninsured rate, these people tend to receive very minimal medical care. With that being said, these people tend to have ailments such as cancer or other forms of ailments that go unnoticed for a very long time. With there being a lot of people who suffer many ailments due to not having health insurance, they risk lessening their lifespan, which is extremely devastating. This is why I believe having affordable health care is extremely important. That way, we can help thousands and even millions of people. According to an article by Healthline written by Tema Ernfield, she states that, end quote, a high uninsured rate, tough Medicaid regulations, and a lack of services has given Texas some of the highest rates for disease and death. On top of this, the article goes into further details on how Texas has an estimated amount of about 4.5 million people who lack health insurance. The core challenges surrounding the topic of healthcare in Texas is the fact that healthcare insurance is not very affordable. Having affordable health insurance would be very beneficial for everybody who lives in Texas and even for everybody who lives in the United States. With having more affordable healthcare insurance, we would be able to improve the public health both in Texas and in the United States. So, what does it mean to be uninsured? When you are uninsured, you are fully responsible for all of your medical services that are done to you. So, this can be whenever you go get a checkup at your primary doctor's office, or even if you go to a dental office. People who are uninsured have a higher risk of receiving less medical help. The uninsured population are more likely to develop difficulties in their health. And lastly, the uninsured are more likely to experience high and unexpected costs whenever they go to physician offices. So, for my last statement, I have a very good example to go with that. I had to go to a hospital a year ago, and my cost was going to be $10,000. But thankfully, because I have health insurance, I only had to pay $1,000 out of pocket. So, this is why having health insurance is very important because it can help you out in so many ways. According to America's Health Rankings annual reports, this graph represents the percentage of Texas and the United States who do not have health insurance. In 2019, Texas had around 18 to 19% of people without health insurance, of approximately 29 million people who live in Texas, stated by the Texas Bureau. Although this may seem like a very small percentage, 18 to 19% of people out of 29 million people is approximately 5 million people in Texas who are not receiving the medical help they deserve because they cannot afford to have health insurance. So, what would happen if health insurance were to be made more affordable? If health insurance were to be made more affordable, we would be able to save millions of lives. The uninsured population would be able to better take care of themselves by seeking the medical help that they need. Think about all of the moms, dads, kids, grandparents, and etc. all over Texas and all over the United States that would be able to finally go to a doctor's office because they know they are covered by insurance. As many of us know, there's no such thing as the word free in the United States. So, some concerns that may rise if we were to make healthcare more affordable is the fear of paying higher taxes or the fear of budget cuts in other regions, such as education. As stated in the previous slide about concerns that may rise due to making healthcare more affordable, my response to those concerns would be that with people having more access to affordable health care, we would be able to lower the percentage of people getting sick or developing health complications. With people better taking care of themselves, they are more likely to be healthier and less likely to miss work as much. With more people working, This allows the economy not only in Texas to grow, but in the United States as well.